Do you know what NUCCA stands for?
No, I wouldn't even try. I wouldn't even hazard a guess on that one.
No idea.
I have no idea.
Nuclear weapons?
An office for some kind of business.
I don't think I could guess.
Natural undercurrents cause cancer awareness.
It's probably something to do with computers.
Neurological, upper something, clavicle association. Was that pretty good?
NUCCA is not a widely known phrase, but what NUCCA stands for is the National Upper Cervical Chiropractic Association. NUCCA is a form of chiropractic care that uses a specific procedure focused on correcting a small misalignment of the neck. This subtle correction ultimately restores optimal balance to the entire spinal column. Because the spinal column protects the central nervous system that controls and coordinates all body functions, good spinal balance is critical to good health. Extensive research and clinical studies over many years have shown that improved body balance effectively reduces stress throughout the body and helps to relieve pain and tension. Even though the primary work is done in the neck, the correction affects the balance of the entire body. This is because the NUCCA procedure subtly influences one of the highest control centers over body balance, the brainstem and central nervous system. The NUCCA procedure essentially helps to get your head on straight. There are many things that add stress to our spinal column. Motor vehicle accidents, a fall, lifting, sitting for too long. Even just the various stresses of day-to-day living can alter our body balance and produce pain and discomfort. After a significant stress or strain to the spinal column, the associated muscles will respond and tighten. The body and spinal column become distorted and less stable. With the spine now locked into a stressed position, every movement becomes an imbalanced movement. This added stress often produces a variety of symptoms that can significantly interfere with the enjoyment of our life. The NUCCA organization has developed a very precise procedure to correct this problem that is based upon mathematics, physics, and biomechanics. The first neck vertebra, also known as the atlas or C1, is a small donut-like ring located at the top of the spine. It is in close proximity to the brainstem, which is the part of the central nervous system responsible for controlling a number of vital body functions. One of these very important functions is the muscle balance of the spinal column. When the atlas is subjected to stress or injury, it can become partly misaligned in relation to the skull and the other vertebrae in the neck. We call this the atlas subluxation complex syndrome, or the ASC syndrome. Even a slight structural misalignment of the upper neck will result in a muscular response that shifts the body balance from normal and adds stress to the spinal column. By making these subtle adjustments to the neck, it is possible to reduce this misalignment and improve body balance. When you visit a NUCCA doctor, an extensive evaluation process begins. Since the severity and type of each spinal misalignment is completely unique to the individual, the process begins by taking a detailed health history. This includes the chief complaints, the location of these symptoms in the body, how they began, and how long they've been present. Any other health problems, injuries, motor vehicle accidents, surgeries, along with other treatment programs, which include diagnostic tests and x-rays, are also evaluated and assessed. After this initial process, the doctor will begin the steps necessary in determining if your spinal column is significantly misaligned or out of balance. You will be asked to lie on the adjusting table, and the doctor will check for a leg length imbalance, which is also known as the short leg phenomenon. This is where the leg is not really shorter, but appears shorter because the hips are imbalanced. Precise measurements of your spinal balance are taken. These measurements are used to determine if you have a significant misalignment that would require a correction. They are also used to determine the progress of your spinal stability on follow-up visits and help in determining when another spinal correction is needed. If it is initially determined that you have significant body imbalance, a specific series of X-rays is performed and mathematically analyzed before your first spinal correction. To obtain an optimal correction, these precise mathematical calculations are used to determine the proper direction for the spinal column to return towards normal. This correction is unique for each patient, and the X-ray series is a critical part of ensuring accuracy and also that a successful correction is achieved. The NUCCA X-ray series involves safety procedures that use low technique settings, along with specially designed filters to further reduce X-ray exposure to the patient. When it's time for your spinal adjustment, the doctor will have you lie on the adjusting table on your side and position your head in a very specific fashion. This is based on the information obtained from the X-rays. The doctor will be positioned in a specific stance, again determined from the X-ray analysis, and will place their hand near your ear. This is where the side of the atlas or first neck vertebra is located. The doctor will apply a number of very light and subtle corrections that move the spinal bones of the neck very carefully. It takes very little shifting of the bones to relieve nerve pressure. The precision of the procedure means the spinal correction is subtle in its application, but the positive effects on the nervous system and improved body balance are not. Because it's important to receive the best possible correction on your first visit, the doctor will take 2 post-X-rays following the initial correction. These post-X-ray films will show the doctor how the spine responded to the adjustment. This is typically done only after your first adjustment. If the X-ray measurements indicate that the correction was not optimal, the doctor will continue to readjust you until a favorable balance is achieved. We know that the better the spinal correction, the better the chance of recovery. Because each spinal correction and healing response is unique to the individual, you will be monitored closely with follow-up visits. These visits help ensure the spinal correction is maintained for as long as possible and the healing process continues. Correcting and stabilizing the spine may require a number of adjustments over a period of time. The objective measurements used in the NUCCA procedure, such as the initial pre- and post-X-rays, leg length checks, and spinal balance measurements, help to monitor the recovery process over time. It's helpful to remember, healing is a process, not an event. Recovery continues as long as the adjustment or correction holds and optimal spinal balance is maintained. Adjustments are only given when the body demonstrates a sufficient misalignment. After your spinal correction, you will want to be mindful of looking after yourself during the initial phase of the healing process. Your doctor will help you to understand what you can do to help maintain your spinal correction. Being adjusted as few times as possible is ideal, and it is our goal to help you achieve this. Hopefully, you now know the importance of good body balance, its influence on improved nerve function, and how NUCCA plays an important role in restoring and maintaining good health. When it comes to offering help for spinal-related problems, we know that no one procedure offers a 100%